Hello, everyone. Today we are here to talk about vaginas.
Yay! Vaginas!
Welcome to another episode of Aesthetic Insights. I am super excited. This is a very special episode and been a dream of mine and our crew to expand into interviews. And we have today Dr. Letitia Oderman, who I love, and we'll introduce her a little more in a moment. We're really excited to launch our new interview segment. It's going to be based off healthcare, wellness, and aesthetic experts that are cutting edge in our field. We are going to start today, like I said, with one of the best OBGYNs on the planet. As some of you may know, I did OBGYN the first 12 years of my career, so I can speak with some authority on this, that you are amazing.
Right back at you.
Thank you. We are very honored to have Dr. Oderman here. She is a top board certified OBGYN in Santa Cruz County, and she is a local. She graduated undergrad at UCSC, did medical school at UC Davis, and did internship and residency at UCSF. Very prestigious program. I know you enjoy your active lifestyle with your husband, your children, 2 beautiful daughters, and enjoy spending time traveling and with friends. We again are blessed to have her here chatting today about some women's health issues. Doing my research on you, I was very touched reading your mission statement. She works with Sutter Healthcare, and I'm going to quote you: "I believe in helping women learn about their bodies as a way to empower them to be active participants in their healthcare. I love my work and consider it an honor to care for women at all stages of their lives." And I feel like that personalized touch is, unfortunately lacking in healthcare nowadays, and really feeling it. And to have someone that really lives her mission is a blessing. So we're going to start off with something a little crazier and then get into more nitty gritty. But what is your craziest OBGYN story?
Oh gosh. Okay, trying to find things that are camera appropriate, but I'll just be authentic and tell you the first thing that comes to mind.
Do.
So when I was a resident, probably a lot of the good stories come from residency, but when I was a resident, I got called to the emergency department one evening and, quick, come down here. There's a woman who's bleeding and her blood pressure is very low, her heart rate's up. These are all signs that someone's lost a significant amount of blood. And so I get down there, my little co-residents, we rush down there and come into the room where she is, and there's blood just pouring on the ground. And I'm not quite sure what's happened. Her partner's there supporting her kind of sheepishly in the corner of the room, and I'm just trying to get, visualize what's happening, and it's clear that she has a really large tear in her vagina. So I fix it up, and then only afterwards did I find out that it was an injury from a playful sex act that happened with a ring on. So I looked over at her partner, who had these big sort of like, heavy metal type rings. So yeah, be careful with your exploration.
Yes.
Can happen.
It's a good lesson to be learned for sure. Yeah.
Oh, sorry, didn't mean to interrupt you.
Go for it.
And that, that's certainly a gory story, but what is more common, and probably I have a lot of, just stories that hit my heart that are more common, but maybe less thrilling or exciting, are just the, dozens of women throughout their, in many age groups, 20s, 30s, 40s, 50s, who've never had an orgasm or don't understand how to care for themselves. So yeah,
I think that really hits home. It was one of the first things. No one taught me that in school, and it was just after talking to patient after patient and kind of my own journey that, like, this is sad, and the sex ed you're taught in school is, these little body parts at an age where sometimes they don't even understand what's going on.
Right.
And then it's never brought up again. And, I think it's, again, what makes you special. where really speaking to patients and making sure that you're cared for, not just your body parts are cared for, but you're cared for as a whole. And
thank you. Well, you do that for all of us too.
Thank you. And important in a relationship for a patient, and also if she's by herself as well, to understand your body. So thank you again for bringing that up. What brought you to women's health?
Well, in college, this is the real story. So in college, I had an unplanned pregnancy, and was grateful enough to be able to go to Planned Parenthood and get services there. I knew that I wanted to go to grad school and probably med school, though I wasn't quite sure what specialty I would land in. And it was really the amazing care that I received there that inspired me to want to give back.
Wow, that's touching. Wow, thank you for sharing.
Yeah, thank you.
I know that's hard for, again, these are discussions that are still, I think, difficult, and they have to be had patient by patient, but to hear a practitioner who based her life on, a specific instance, that really means a lot. And hope there's going to be more of that out there. What is your favorite part of women's health?
I mean, it's always different. No day is boring. But really, it's the meaningful interactions that I have with patients, getting to know them, who they are, what their family structure is like, how to support them in being their best selves. So the medical stuff is, of course, interesting, and I get to geek out in different ways, about the science of it, and I love doing surgery, and all that stuff is fun. But it's really these heartfelt conversations that, fill my heart with joy and keep me going, even though the hours are long.
Yes, and that's one of the things. When I first met you, I was so impressed. I think I even said, "How are you so sane?" Because I remember, you don't know, babies come at 2 a.m. You don't know how your life's going to be disrupted when you're trying to plan a day, but you're on call, and then you go to the office and you're with a 15-year-old and an 80-year-old, and you seem to have just such a calm, sweet, funny demeanor at all times. So
thank you.
I was so impressed by that, because it is a really difficult field. I don't think people realize the extra challenges on top of medicine.
Thank you. Well, we'll keep complimenting each other, because I always think the same thing about you. I'm like, how do you run a business and are such a skillful practitioner and always have a smile on your face?
Because I'm not on call anymore.
Okay, good.
I defend my sleep. But yeah, it's interesting to hear you speak, because I feel like when I was doing women's health, and then when I've transitioned to here now I geek out on lasers, and as most people know, but it's being in a room with a patient and being able to connect that I most enjoy. And then of course we're able to bring our science, and mix that together. So it's funny to hear you say that. I really feel the similarities. I think that's why this came naturally to me. What is your biggest frustration with healthcare, women's health? I know this is a huge topic, but if you had to pick 1 or 2 things.
Frustrations. I would say more and more there are just so many administrative pressures. Documenting in a specific way sometimes takes away from time that I have with patients, so kind of narrower appointment slots. Or what usually happens for me is I just spend the same time, and then I'm running a little late, which I know is frustrating for patients, or it eats up some of my family time because I'm charting it, whatever hours. So that's probably the main frustration. I think that has the potential to lead to some less of a personalized approach, depending on the clinician. And that's sad, because it means there's less of that connection, and when we don't know each other as well, clinician doesn't know patient as well, and patient doesn't know clinician as well, there's less comfort in sharing things you might not be as proud of, or questions that you have that you might be embarrassed to ask. And that's so important.
No, Thank you for sharing that. On the topic of GSM, so it's this new topic since I've left OBGYN, the genitourinary syndrome of menopause. So they changed it into this thing, and I was like, what the heck is that?
I know, I'm glad you said what that was, because I'm like, what is GSM? What is
yes,
GSM?
Yes. And I am like, And so, as you guys may know, we do DiVa here, which is for vaginal health, for incontinence, dryness, loss of sensitivity. And it was the whole, topic of last year's Sciton conference. They had an OBGYN speaking about GSM. And I'm like, okay, I need to learn the new lingo. But they turn it into such a, I think, scary word, which I think has done women a disservice, because I'm like, I have GSM now. It's like I thought menopause was normal and natural, and now I don't even want to speak about it because I feel ignorant, and what are your thoughts as to, like, I'm really excited we have DiVa, but it's just so hard because not covered by insurance. I don't know how to get the word out. I feel like some OBGYNs they just don't know because everything's very corporate now, so the corporation doesn't have one. And to trust us that this actually works, because some of the older devices I know don't. What are your thoughts on that, and how do you present options to your patients?
Great question. So backtracking a little bit, I tend to not use that terminology, which is why I was like, what is it? But the way that I describe it to patients is similar to the rest of our skin, where we lose elasticity as we age, even though I'm fighting it tooth and nail. Thank you, April. We lose some elasticity down there, and so not to use too harsh or graphic of a visual, but I always describe it to patients as like a rubber band. Like if you have an old rubber band, it can crack more easily.
That's a good
it just
one.
doesn't stretch as well, and so what can happen to the vulva, being the outside tissue, and the vagina, the inside tissue, is if there isn't enough elasticity, and there are some ways to regenerate that, such as DiVa, such as using estrogen topically, other, just practicing good skincare down there, which we'll talk about in a second. But without that, with penetration, whether that's digital penetration with a sex toy or with a partner, there can be some skin cracking. And then that can lead to, of course, pain, bleeding, discomfort, and then almost like a vicious cycle. If you have pain, why would you want to do something that's painful?
Right.
And so then maybe, our libido as women is so multifactorial, so then you're less interested in wanting to at least have penetrative sex, and it can just be terrible.
Yes.
Urinary tract infections are more common, again, because that skin is just thinner, and so it's easier for bacteria, which we already, as women, have really short urethras, so now there's less of a barrier against bacterial infection, maybe more urinary frequency, feeling like you have to pee all the time.
Yes.
So all of these are really impactful and just really uncomfortable.
Yes.
Getting back to your original question, you're right that a lot of us as OBGYNs don't know a lot about the use of lasers. In fact, I had to do my own homework before today to look at, I always try to look to the medical literature, so I looked at PubMed. There was a study that I'm sure you know about, but what's new to me is called the Velvet trial, which was like a randomized controlled trial, multi-center. These are all the buzzwords for a good quality study that we look at, that compared the use of vaginal laser to vaginal estrogen, which is kind of our main arsenal, and found them to be at least equivalent, and a trend towards the vaginal laser being more effective, but it wasn't statistically significant because there weren't enough people in the study to increase the power of it. So that to me is like really cool and sexy, and I wish that we knew more about that. I'm educating myself alongside my patients as it becomes more pertinent for me. I'm 48 now. Like, yes, what are all the things we can do?
Yes.
And I feel like I'm better able to support my patients as they age alongside me. So yeah, the laser I think is a really great tool. There are patients who can't use estrogens
Right.
because of certain health conditions, like history of hormone receptor positive breast cancer, for example, or there are patients who just find the estrogen use intolerable. Maybe they, have burning,
Right.
which is really common with it, or just aren't comfortable with doing it, or they might even have conditions like there are some vulvar skin conditions like lichen sclerosis
Yes.
that benefit greatly from it. So I think, educating providers like you've done for me, and then, so many of us get our information from social media that I think, avenues like this, putting it on Instagram, anything we can do to get the word out that there's help for women. One thing I often will tell women is we do such a good job of taking care of this skin and we forget about this delicate skin, and she needs love and attention too, or maybe your vulva is a he or non-binary, but
Yes.
my vulva is a she. But yeah, so I tell all my patients to use a little coconut oil at bedtime, just like a little dab of coconut oil, just like we put lotion on our face.
Yeah. Okay.
Just to moisturize that area before bedtime, for example.
We'll be spreading that word.
Yeah, think about lasers, or talk to your provider about some topical estrogen vaginally.
Yeah, it is exciting. I know when DiVa came out, now it was FDA approved, so obviously you have to have some science behind it for the FDA to do that. A lot of the other lasers did not have that, so they were kind of like, oh, why should DiVa? You can't say these things. So they said, oh yeah? Well, and they did their studies and whatnot, and the FDA isn't always the best, but you definitely have to set a standard in order to be approved, and the safety is pretty incredible as well in the hands of someone that knows what they're doing with it, and the comfort as well. So it's exciting times, just like for the skin.
Right.
You used to have to do insane things, and now it's amazing with halos and whatnot how with minimal amount of downtime, the results and safety that we have.
Right.
On the just to kind of wind things up, do you know about Kim Anami, the vaginal kung fu expert?
No, who is Kim Anami?
So she is I guess she's labeled as a holistic sex and relationship expert.
Okay.
She had a very unique childhood, and so kind of explored this world, and she was one that at a teenage year learned what an orgasm was and just was very comfortable with her body thanks to like her mother. And I never had that conversation with my mom, as I'm sure most of you didn't. And never had a good OBGYN until I literally became a PA OBGYN. And it takes a second, so she took this road and was shocked to hear that a lot of people around her knew either nothing about their body or had not experienced anything, such as an orgasm. And so she saw, a lot of people do biofeedback therapy for incontinence and whatnot. She thought she took Kegels to the next level, we'll put it that way. And so she found a method of sticking different things in the vaginal canal and strengthening, and starting off with like a jade egg or something smaller. But she strengthened her pelvic floor so much that it's a little crazy. But if you look at her website, you'll see like a kettlebell, and it's all very discreet. She's wearing a clothing and a skirt.
The front door.
I'm not kidding. And there's like a kettlebell or a surfboard hanging from her, and you're like, and at first I was kind of horrified because I said, okay, now we're gonna have women doing that and they're gonna prolapse, like their uterus will literally fall out of their body.
Or go to the ER because they're bleeding from the
right.
Sharp surfboards.
Wrapping everything back around to your first story. Now, as I've kind of researched her a little more, she does not advocate jumping into that, but it's what your body can do if you actually train it.
Right.
And it's all meant to help your sexual experience. It's meant to help incontinence. If you've had issues after pregnancy, having a baby. I've never had a vaginal birth, but I started having issues in my late 40s. I'm like, oh my God, how is this happening to me? And I knew it was going to come. And so it's so cool to actually, again, have people speaking on this. And again, I think her approach is awesome because it works.
Yeah.
And she also brought up one last topic of, I think she lives in Bali now. And a lot of other cultures, they don't talk about menopause as a big deal. So they don't treat it as a big deal. And women tend to do better. They don't, she's like, I don't know why. They don't have the brain fog, they'll have hot flashes, but like it's not as huge a deal. And then she studied us, and like they said, it's one of the biggest money making age groups. Like you need 5,000 supplements, and this is wrong with you, and this is wrong with you. And I think it's good that we're talking about it, that this is not just part of aging. You can do something about it. But I found it really fascinating that there's maybe more of an emotional component and a societal support. That, oh yeah, you may have a few symptoms here, let's help you out so we don't make this into a huge deal. What are your thoughts on that?
Gosh, I have so many thoughts. The first thought is she sounds really cool.
I figured you'd like her. You gotta check in.
I think that sometimes shock value, because it sounds crazy to have a woman hanging a kettlebell from her vagina. Like, how is that even possible? And how cool is that? And don't put surfboards in your vagina. But I think that is gonna draw followers to then hopefully hear other messages. And so having people like her sort of facilitate good messaging is really important. And I think how we're going to educate all of us as women, no matter our age, about these important topics. I think related to menopause, you're right. I see a lot of people fall prey to just spending a ton of money, or maybe, with 1,000 supplements, or, self-help, this or that book. And really, there are a variety of approaches that can work. And it all comes down to, what are your symptoms? How much are they impacting your quality of life? And working with someone you trust, and usually it's a team of people you trust. You're my skincare person, who I also just love. I have a therapist, I have a personal trainer. I think we all need to find our tribe to support us through whatever stage of life we're in, and menopause is just one of those stages.
I love that. I think as we close, that is such an important message, that it is a tribe. The one thing OBGYN taught me, and my patients taught me when I was younger and just starting in my career, I would see women alone. They took care of their children and partners and work, everyone else. And by the time they hit their late 40s, a lot of them were getting divorced. They're overweight, they're unhappy, unhealthy. And men tend to do a better job of, I'm sick of this, I'm out, I'm going to go take care of myself. Oh, you're so selfish. Well, I think we need to be, it's not selfish. We need to be okay with reaching out for help and having a tribe and really budgeting appropriately. And I spend all my extra money literally on my tribe. And I could have all this extra money to travel, but it's literally the same thing, my mentors, my people I can talk to. So thank you for bringing that up. That is a huge message. And hopefully for some of you who are younger, start your tribe early. You don't need a ton of money, but make sure you have good people, non-toxic people in your life, I think is a good message as well.
So true.
Any last comments or anything you'd like to share before we close?
Just thank you for what you do for our community, and for me, and for all of you. Really appreciate you.
Thank you. And
giving this opportunity for me to share some thoughts.
And thank you for being our first guest. This is, I feel like we're going to do some great things with this. Would love to have you back on as well.
Sounds
and
good.
Thank you again.
Yeah, thank you.
Well, thank you guys for staying tuned. And if you liked this episode, please subscribe. We're going to have a lot more fun stuff coming. If you have any questions, obviously call Pacific Coast Aesthetics. let us know, and you can comment or ask your question below, and we'll be happy to answer that for you. And remember, as our PCA theme is, inner health is outer beauty. Take care. Bye.